Who let the dogs out?
Who let the dogs out? Who let the dogs out?
It's time for Pet Files Ask the Vet, underwritten by the Millerton Veterinary Practice. Traditional small animal medicine and surgery, chiropractic, laser therapy, acupuncture, and Chinese herbal medicine. 518-789-3440, millertonvet.com. With us today, Dr. Carolyn Cannon, owner and chief vet of the Millerton Veterinary Practice. We are always happy when she can spare the time. Hello,
Good morning.
Dr. Cannon. Oh, straight to the questions because this has got me going already. Miriam in Queens. Since the start of the pandemic, it seems like every single person in New York City got a puppy. Here, too. Since a lot of them are first-time dog owners, I find myself wishing I could issue PSAs for them. For example, don't let a whole pack of other dogs chase your dog in the dog park. It never ends well and can easily go from a playful game into a dog fight. If you could make just one or two PSAs for the puppy owners, what would it be?
That's a great thing to bring up. I'm seeing many, many, many more puppies than I usually do, and we are spending a lot of time educating people. Puppies are not easy. They're a lot of work. They leave you tired, and you're tired at night because you're not sleeping, and then you need to get out there and do all kinds of exercise with your new puppy. So what I would say are the things that are most important to me, but because of the longevity of your dog, and that means having a dog who can be with other people and other dogs and behave correctly, and a dog who doesn't get obese. So those are two of my highest priorities, and my soapbox would say my public service announcement number one would be to socialize, 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 socialize. But be careful that your puppy doesn't have any adverse events in that socialization process. And so, yes, using common sense about letting a pup off leash, number one, depending on the age of your puppy. Of course, as they get older, they'll have a little bit more autonomy. But if you've got a small breed dog off leash at the park, these other dogs, I don't think that they have a malicious intent. But, I see my own dogs do it when they're off-leash on a walk with a puppy. The puppy looks like he wants to play, and he's so excited to see the other dogs, and my guys start playing chase, and it scares the heck out of the pup, So and if that's a pack of dogs at a dog park, then that's what I would call an adverse event. So we don't want things to happen to your puppy at its most what is the word I'm looking for?
But basically, when it's when it's going to affect them for the rest of their lives.
When it's most impressionable, right? The poor guy would remember forever. These things do make an impression. So we don't want them to be afraid of other dogs. We want them to be happy to see people and happy to see other dogs. And sometimes you might want to pick up your puppy if the other dogs are being crazy, and then pick and choose who you want your pup to be socializing with. And that's, of course, when your veterinarian says it's okay to do the social thing with dogs that you don't know. It's kind of nicer until they're about 18 weeks or so and fully protected with vaccines to choose a couple of friends to socialize with, a couple of friends' dogs. And you know where they've been and what they've been doing and how they behave and, interactions one at a time. But the socializing is so important so that you have a dog that you can take out in public and it knows how to behave. He or she knows how to behave with dogs and with people. Otherwise, your dog gets left at home, and what kind of a life is that? My second public service announcement is about feeding. You want to discuss diet with your veterinarian. Feed a healthy, species-appropriate diet, and importantly, I think after 16 weeks of age, depending on how small the dog is, most dogs can go on twice-a-day feeding. They need a long period of time during the day when their tummies are empty. And I know that we do a lot of treat feeding in order to train, and I understand that. So at least at nighttime, a good 12 hours to sometimes even 16 hours of empty stomach helps them to promote a good microbiome so that you don't have this dog with constant diarrhea or quote-unquote GI issues is what we see so much of. Avoid antibiotics like the plague if you possibly can when they're little. If they are on antibiotics, then you need to do some appropriate care to try to prevent problems with the antibiotics, which is a whole other soapbox. But what I'm getting at is if we can do things to keep our pets from getting overweight, then you're avoiding the painful joint situation and the all of the things that go along with obesity.
All right, so I'm going to interject here because I have just been exposed to basically what is called puppy parenting. And forgetting the anxiety aspect. So one aspect of this is psychological, anthropomorphic psychological, but the other, the first one I want to touch upon, and it made me feel very old. You just said 16 weeks when you take them off 3 meals a day.
Mm-hmm.
I have always taken my dogs off right around that time. I think somebody told me to start doing that, mostly because if you're trying to forgetting the gastric stuff and the fact that their tummies need to be empty.
The house training.
The house training, and that was so that was key. That was huge for me. However, I just encountered a group of people who now believe that a veterinarian recommended 6 months to knock out that third meal.
I don't agree.
And I wanted to ask you about that because I was about to jump in my nephew's,
If you have a tiny dog that has trouble, sometimes we breed these dogs so little.
Labrador.
And they have trouble maintaining their blood glucose, then absolutely. But I'm talking about your regular size, that's
Labrador
going to be 20
here.
pounds and up.
Labrador. So
yeah.
I would have put him through like 16 weeks. I would just my natural inclination would be to knock out that third meal. And so before I blundered in with some unwelcome aunt-like advice, I just that stuck out. That was A. B. In terms of socialization, what I am noticing with these kids, and they're there's almost an industry that has sprung up around psychiatry for their pets. You aren't anybody unless you have separation anxiety. Unless you can sit around and discuss the separation anxiety that Brandy is having with, every time you leave the apartment, and how horrific it is for both parent and pet.
That's a really good point in this COVID time. I hadn't thought about. Yeah.
So
separation anxiety. So you need to be able to leave your puppy alone in the house without you for several hours. And I think it's not only advisable. It's not only necessary, but it's advisable.
So what would you say to a young parent, basically, who doesn't have the experience yet that the baby will stop crying, I happened to see. And I was really pleased to see it. And they cut the poor guy. They cut this guy off. He was a dog trainer. It was on TV. It was a broadcast network that's usually quite useless. But the guy totally knew what he was talking about. And you can tell when you've got the right dynamic with your pets. And he had multiple. And this lovely young woman came on, and her voice was really high. And she was talking about how just like whatever the dog's name is, just terrible, terrible anxiety, just every time, and just barks and I don't know what to do. And basically, he very nicely said, "Hey, it's you." But he said, "I can tell by your voice that that you both feed off each other, or whatever." I'm paraphrasing, and that what you need to do is make it okay to be alone. You have to stop worrying about the dog being alone, and what you want to do is start doing, you leave and then you come back and you don't go rushing in and.
And to be fair, in New York City, you have to be cognizant of your neighbors complaining when your puppy's screaming and howling and all of that, and that's a real problem. But you can just walk down the stairs and go outside and hang out for 15 minutes. But you want to always you have to crate train and make that crate a fun place. This is my fun and safe place, and everything's cool. And part of that is maybe keeping the puppy in the crate overnight when everyone's sleeping. I know sometimes it's way easier to put them on the bed, they shut up, and they stay asleep most of the night. Or if they're going to have to pee, they'll start to move around, and it wakes you up, and you can take them out. But the crate training is a great idea for that. And then they're used to being in the crate. It's their safe place. You put them in with a Kong. Take a Kong and put some special stuff inside of it so that your pup that's the other thing with feeding them too frequently. You're going to have a dog who doesn't really care about treats for training and doesn't care about a Kong when you go away. Put something in the cage with them, in the crate with them, so that they're working on that when you leave and they're not paying attention to you. You don't make a big fuss about going in the crate, and you don't make a fuss about closing the door, and you don't make a fuss when you're leaving. You don't say, "I'll be back soon."
Well, I think that's part of what's happening. And I happen to know that in my nephew's case, there are 3 puppies on the floor, and one of them is about being sent to boot camp because they just can't, they just can't handle it. And I'm thinking, well, this is a young dog. What there is, and I'm sure that you have encountered this along the way, is just there's a lack of practicality. I mean, I can't remember how we were all brought up with dogs. And it just it's less it's I'm going to say it's less anthropomorphic. I can never say that word well, but how would you recommend to someone who hasn't really had the experience of dogs or horses or a farm or just like this is their first rodeo, so to speak? That it's okay.
I guess you do have to say that you've got to keep in mind that they aren't humans, and that they, in the wild, the mother would leave the pups in the den by itself for a day, and so they are okay. You have to make sure that they're accustomed to being alone, and that it's okay to be alone and nothing terrible is going to happen. But you have to do it even if you just go out in the hall and sit for 15 minutes and then come back in, and if your puppy's jumping at the crate, you hopefully you've trained them to sit, make them do something quiet, and when they're quiet and not being crazy, then you open the door and you walk away. So walk away. What I would do with my pup is walk away. I go to all the way down the hall, turn around, say sit, and as soon as they do that, then I reach down and pet. Say good boy. Now, if they're being quiet when you open the door, that's a time also to say good boy. So you want to just think about, it's really hard, but you have to think about rewarding the desired behavior. And, it's hard when you have a puppy and you've just gotten a pup, you've watched everyone with these wonderful dogs who can walk beautifully around New York, and they play together, and they take such joy in it, and you wish your dog could do that. But they will if they get a good start. You just have to be patient.
Right, and you're absolutely right about the good stuff. All right, thank you so much. In fact, you could do an entire course on this, but why wouldn't you be able to? All right.
Well, a good trainer is worth a lot too. That can, someone who can talk to you and talk you through this.
Oh, I would, but I think that's almost like giving your kid that test that you have to take to get into nursery school in New York.
I don't know about that, but anyway.
Yeah, just seriously, it's de rigueur along with but in a funny way, it's necessary, but it kind of comes with a little thing to it. It's more like, well, I've got a special trainer rather than, what you need is someone with common sense who can make both of you feel calmer and more in control of the situation.
Yes, if you're a new pet owner,
yeah.
Absolutely.
And that's harder. Again, I believe that there's an industry springing up around this because it's very easy to charge, if you don't know what the parameters are, it's easy to, make your own and pay a lot of money for something that you might not otherwise do that with.
But it's important to look for someone who trains who does positive training. Almost
Absolutely.
Everybody does these days.
Yeah,
so, yeah.
But I think it's.
I know what you're saying, but I think that I could tell you that a lot of the, the trainers are so busy, and if you're having to deal with questions from 10 people an hour, then, I think that I think they need to charge for their time. And,
they do. No, I mean,
yeah.
we're talking in the thousands. But
yeah.
But
it's all relative, I suppose.
But I think it is. I just it's just, if you are paying that, you definitely want to find someone who's, low key and not someone who's meeting you on your oh my God.
Exactly. Yep. I agree. Yeah. You need someone who's relaxed, and you should be able to get references and see how they behave or how their animals behave with them, and get a video of a class that they've done or something like that. I think that's a great advice.
Yeah, no, and I think it's smart. You got to screen them. All right, Lucas and Christina in Warren. We are not big fans of antibiotics, but when our 7-month-old kitten got a respiratory infection, we didn't have a choice. What can we do for her to ensure her gastric flora is protected and restored after the course of antibiotics are done?
I'm going to get it back on my soapbox for a minute. So not almost all respiratory infections are caused by viruses. We all know that antibiotics do nothing for viruses. Kittens, of course, are more susceptible to secondary infection. But I also believe that we, as veterinarians, over-prescribe antibiotics, and it's partly due to pressure from people who they absolutely want their pet better right away. So I'm just throwing that out there. If you have a veterinarian who says this is viral and there's no need for antibiotics, please be okay with that. And sometimes you might have to bring your kitten back, yes, if they get sicker. But sometimes we need to allow them to be ill and curl up and rest like you would with a sick child, and not necessarily give them antibiotics. Now, with that being said, if in fact they absolutely need to have antibiotics, they're running a high fever and not eating, and lots of goo coming out of nose and mouth, then my choice would be to use Saccharomyces, which is so it's not technically a probiotic in that it's not bacteria, but it is a supplement that you can give, which helps to keep the gut healthy. It's been used in people for many years for the prevention and treatment of Clostridium difficile, I think, and there aren't any side effects from giving it. Nutramax has blessedly come out with a product called Mysoquin, which not only has the Saccharomyces in it, but it also has beta-glucans, which we know it's a polysaccharide that helps to support the immune system. So what I do often is I'll put dogs who I know, even adult dogs and cats who I know have trouble with antibiotics and they end up with diarrhea, I'll put them on Mysoquin and probiotics during the course of antibiotics, and then maybe for a few days afterward, and then continue on the probiotic for another week to 3 weeks to even a month after antibiotics. So the first thing you want to do is make sure that your kitten is on a really healthy, species-appropriate diet. If there's a lot of carbs and sugar in that diet, you're going to overgrow the bad bacteria anyway. So we've got your kitten on a good diet. Then my suggestion would be antibiotics with Mysoquin, and doesn't have a cat. I don't believe it has a cat on the label. It's not approved for cats. Neither are most of the things that we give cats. Unfortunately, cats are second-class citizens in the world, and so they don't have lots of drugs approved for them. They don't have as much research done on their diseases as well. And so, but Mysoquin is okay to give to cats, and you can also use a probiotic such as Proviable is what I think is a good one. And other than that, then you just go with it and hope that your kitty doesn't end up with having to be on antibiotics long term. So a nice short course of a week of antibiotics, protected with a couple of products, and then move on from there. And hopefully we don't need repeated courses of antibiotics.
And has that shifted along the way?
Yes, absolutely. I mean, there is more research being done, but for instance, a dog with a simple urinary tract infection really, the research shows we should only need to be treating them if we think it's a simple cystitis, bacterial cystitis. We should only need to treat them for 3 to 7 days with antibiotics.
Right. So
not this 2-week regimen,
which used to be just always. I'm just sidebar. Totally used to be counterintuitive. It's like, why does everything require this? It's like, why does everything have to be mashed with a mallet? It was just always a question that I had when it should seem like something could be dealt with. If it was, low key, not low key, but not if you caught it early enough. So I just.
Yeah, if it is simple and straightforward. If there are underlying causes to have cystitis, of course, then that's a whole different story. Right. To help a kitten who is, and there are other things we can do to help. They make a product called Immuquin, too, for kittens and puppies that you can help to support the immune system. So the first thing I would do is go with Immuquin and not necessarily an antibiotic. But I'm not saying that your veterinarian did the wrong thing at all. That there are many instances where antibiotics are indicated, and you don't want to have a pneumonia with your baby. But if you can do the protective route of Mysequin and Proviable while they're on antibiotics, and continue on with the Proviable in this kitten for another month when they're off antibiotics.
All right. I think we've got time for one more question. This is Rodrigo in Middletown. I take my dog with me pretty much everywhere, so this question's bothering me. Everyone knows that the temperature inside a car can get crazy high on a hot day, so you should never leave a dog inside. But what about leaving a dog in a car on a more temperate day? For instance, if it's 60, 65 degrees out, could you leave a dog in a car with a window cracked? What's the cutoff point of being too hot?
Yeah, unfortunately, there's no cut and dry temperature. You have to take into account, number one, how long you want to leave your dog in the car, how much space you can open the windows, how much airflow there is. Is it a nice windy, breezy day? How much direct sun is on the car? What I can say is that 60 or 65 is too hot to leave a dog in the car for more than 5 minutes. You should try it. Put your coat on and sit in the car, and wherever you want to leave your dog, and roll the windows down. Just crack the windows and see what happens after 5 minutes. How warm you are.
Yeah, no, it's a very human thing. The human temperature and dog temperature are not the same, and it's very difficult.
Well, they
for
have
humans.
Their coats on,
I understand,
so we have to remember.
But it's just about calculating. This is a civilian thing. That's really good advice. People should try it with their coats on and see how long it takes to get A, very warm, and then B, if you're at all active, if you don't like being left, you got to add that on too.
You really work up a temperature, and if you've got 2 dogs and one of them is excited and panting, then you've got the body heat from 2 dogs in a not very big car, and they might have to touch each other in the back seat. So all of those things factor in and can make that car so hot that
so quickly. Yep.
Yeah, so if you have really cool air outside, at least they can put their nose up to the cool air, breathe it in, and really cool the body from the inside, through the lungs. But 60, 65 is too hot for that. So it's a real judgment call. 40 degrees is probably going to be okay if you want to leave them in there for 15 minutes.
Yeah.
And it's hard when you go in the grocery store not to get... Well, nowadays people don't talk to each other so much with the mask on, but it used to be that you'd forget that your dog was in the car, because you meet people in the store, so you think you're going to run in for 5 minutes, and then you see 12 people, and you're stopping and chatting, but people don't chat anymore.
So, at least that's good for the dog left
in the car. Good for the dogs.
Right. All right, thank you very much, Dr. Cannon.
Thank you.
This has been Pet Files Ask the Vet, underwritten by the Millerton Veterinary Practice, 518-789-3440, millertonvet.com on the web.
Who let the dogs